Good afternoon, Princeton Integrative Health Community. How is everyone? It is Wednesday, April 22nd. Um, Talking about coronavirus today and what we know about immunity to the coronavirus, implications of that. So, there's been a lot of discussion about this, about whether being exposed to the coronavirus actually confers immunity. So we'll do my best to give you the greatest understanding right now. And this obviously will be modified as we gather more information. So, most of the rapid testing that's done right now is the looking for acute infection. Whether you currently have the virus. That's that nasal swab test that they do that President Trump, and I'm sure most people who have it, agrees a very uncomfortable test. Nasal swab goes in, goes pretty far back. It goes all the way back into the nasal pharynx. You feel like it's about the middle of your brain. And it scrapes a little bit, so it's kind of uncomfortable. But, I haven't had that particular test, but the flu swab is done exactly the same way. So if you had a flu swab test, you know what we're talking about. So, there's that test. That's not what we're talking about today. That can only tell us if you're acutely infected with the virus. We're talking about today are the antibody tests. Hi, Nancy. The antibody tests take some time for antibodies to develop. I don't know who saw my basic antibody immune system video. What happens is a virus enters the body. There are certain cells that grab onto that virus, present it to specific B cells. They're called immunoglobulins, and they make those. They actually make the immunoglobulins, the antibodies, and those are very specific to each virus, to each bacteria, that kind of thing. So that when you are exposed again, the hope is that having seen it before, there's memory to that, and the immune system quickly develops a rather strong antibody response and takes care of the virus or whatever else is invading. So, coronavirus, COVID-19, there has been shown that there's an antibody response, but it's so new, so novel, that we don't know exactly how much protection that antibody response offers. So historically, if you have been exposed to the flu or coronavirus, you will develop antibodies that protect you for about a year or so, maybe even a couple of years. We just don't have the testing yet to tell us whether that is true with the current coronavirus. Most people think it's true based on historical data with these other coronaviruses, but we're not sure. What the antibody tests can tell you is that you have been exposed and now have cleared that current coronavirus from your system. Most people, most experts seem to think that you will have immunity for a period of time, whether that's months or a year or 2 years, we're not sure yet. Certainly one would expect within the coming months that the virus will not mutate to the point where you will have problems with immunity. But we don't know for sure yet. As I said, more testing is needing to be done, and we will have more information as those tests are done. So, but I mean, we're talking about reopening our economies. We're talking about people being on the front lines. Um, you know, I think most people feel that, they're probably going to use the antibody test to help tell us who's safe to be out there working during this time when the virus is still circulating. Again, we don't know for sure that that's going to be true, that those people will actually be protected. Or, there's another scenario that they're protected themselves, but they can pick up the coronavirus and pass it on to others. We just don't know. Probably unlikely. If you probably have enough of an antibody response to protect yourself, it's more likely that you're not going to be able to pass it on. But again, we don't know for sure yet. Again, all these need to be elucidated. But we, you know, we need to do something. So I think we are going to be doing a lot of antibody testing. I saw last night that the we're hoping to ramp up to so that about 30 million tests per week can be offered. If they actually ramp up to that level, then the whole country can be tested in 11 weeks. If everybody's interested, um, but we'll see. We'll, we'll see who has been actually exposed. Guess there's an interesting fact that when they tested in California, a couple of places they did more widespread testing, like in LA. Um, they found that the number of confirmed cases were about 1/50th of the when they did the more widespread testing. Um, that there were 50 times more cases. So there were 7,000 confirmed cases um, in one of the Los Angeles counties. And when they did the more widespread testing, it actually turned out that there were more like 350,000 people who had been exposed. But that's only about still was only about 5% of the population. So there was still a lot of people who could be infected, even though our numbers appear to be low. The numbers are obviously way higher. How that shakes out with the fatality rates and that kind of thing, we'll still have to see. And I know people are pretty focused on that the fatality rate is actually lower, so we should reopen the country. I guess my thoughts on that are that people are dying who you don't expect to die based on previous flu seasons and that kind of thing. So that's a disturbing thing. That some people who are younger and healthier apparently are dying with even some quote no previous risk factors identified. Except obesity has not been counted as a risk factor for dying from the flu. Um, Obesity, metabolic syndrome, insulin resistance, that kind of thing. And I believe that, we have seen that certainly emerge as a risk factor, certainly a risk factor for being put on a ventilator. And that's what's so different about this that is disturbing. And because America has rates of obesity that are like between 30 and 40%, that puts a lot of people at risk, a lot of people at risk for ventilators. So that was one of the reasons, that I think trying to flatten the curve made sense. That with that many people at risk, I think if we didn't socially isolate, we would have seen much higher death rates than we are seeing now. I guess time will tell. Some states are reopening sooner than others. So we'll see what happens with that. So, after all that news, what can we do? We can do um, things right now. We can start working on nutrition. That's something you could start today or tomorrow. You know, just need to get out to the grocery store, change what you're eating. We should be moving towards diets that are less processed foods, less carbs, less sweets, and more plant-based, more vegetables, more fruit. Um, you know, and to decrease our weights. If we're in the obese category, we certainly want to start eating so that our weight comes down to decrease our risk. Those are probably the most important things we can do to help our immune system. You know, can we also help with supplementation? I believe we can. I believe there are certain supplements that can be used. Some companies actually have immune support packets, but things like vitamin D, zinc, vitamin C can certainly be helpful during these times. Certain mushrooms can be helpful. Please check out Jenna's Immune Support More page on Facebook so that you can get her immune support tips. But I think the overall thing that we can all do is to eat better, eat cleaner, eat more organic, you know, and especially reduce the carbs and sugar, um, so we can start decreasing our weights if we're in the obese category, um, so that, you know, be less at risk. I detailed the reasons for why increased weight for obesity is um, a risk factor. I'll just go through that quickly here. Obesity, again, just the weight of the tissue, um, pressing down on the lungs and pressing up from the abdomen decreases diaphragmatic excursion, the amount of room you have to expand your lungs with the diaphragm. So that puts people more at risk for pneumonia. And if you're not breathing as well, you're not ventilating as well, you're just not getting as much oxygen in and not removing as much carbon dioxide. So that puts people at risk right there. And then the fat itself is metabolically active, so it is inflammatory. So that inflammation puts people more at risk for the so-called cytokine storm, where your inflammation goes crazy and just starts damaging tissue around it. That's almost like a friendly fire type of scenario. So, and then also because your body's expending resources to try to keep the inflammation down from obesity, don't have as many resources, so your immune system doesn't work quite as well. So, therefore, that again puts people at risk. Immune system not working as well, inflammatory system not as well modulated, and just the physical actions of the weight put people more at risk. So we want to decrease that risk. So we want people to lose weight as best they can. And if they have trouble with that, please check out our Facebook page, Princeton Integrative Health, or our website, princetonih.com, because we help people who have difficulty to lose weight. And people lose it rather rapidly with our metabolic reset program. So, all right. I am not. Anybody have questions or anything? I'm not seeing any questions just yet. I hope this is informative to people. Seems like a lot of people tend to watch this afterwards, so I hope that's informative for people. And please let me know if you have questions. And okay, very good. Yeah, there's more to come certainly on this antibody testing and antibody response and immunity related to positive antibody tests. It's not perfect information yet, but it's the best guide that we have. So hopefully, we will be able to use this. I think we're going to be using it whether it's good information because it's the only information we have right now. I certainly would feel more comfortable knowing somebody had positive antibody response, that they would have some immunity for sure. Oh, that's what I was going to mention. That, I think that there is something to this positive antibody response. They're doing trials using plasma, that component of blood without the they spin the red blood cells out. They're using plasma for people with severe illness. At least the preliminary indications is that it's helping some people. And, one would think that in the plasma are the immunoglobulins, the antibodies that people have developed. And that's what's helping people. They did this also during the Spanish flu back in 1918, and they seemed to think it was helpful then. So an old remedy gets new life in these novel times. So again, please contact us at Princeton Integrative Health if we can help you in any way. Again, check out our immune support and more. And let's see, I do have a question here. Roger says SARS-CoV-2 mutations seem to be happening rapidly, especially in the spike protein affecting infectivity and virulence. Thoughts on whether virus might be getting weaker over time? I haven't seen any evidence of that yet, Roger. I know that when the virus first came out, I believe it was dubbed the L strain, and then a couple of sequences changed, and now it's in, I think, the S variant. I think that's the way it went, or it could be started as S and became the L variant. They said that they're so close that they don't think that there's too much difference. It could be getting weaker over time, but it also, could be staying the same or even getting a little more virulent. But no way to tell for sure yet. So, we need to gather more evidence there. Wish I could say something more reassuring about that. But again, the things that we can do are to just try to make ourselves better, support our immune system, and that kind of thing. So I think social isolation is great. I think going out and wearing masks and being careful about using, bringing your hands to your face, I think saves a lot of people. The folks who are, getting a lot of viral load are the ones that are getting infected, even sometimes with protection, those frontline workers in the ER and that kind of thing. So I think that's your biggest risk. And a significant, they're saying it's not a significant exposure unless you're 15 minutes or more and somebody you're not protected at all. That's considered a risk. Less than that, it doesn't appear to be spreading very well. So, yeah, just take precautions. I hope that answered your question. All right. Wait just a minute, see if there are any more questions. If not, I'll be signing off. I hope everyone's staying safe. Hope everybody's family is doing okay. And we'll see where all this goes. I think there are thoughts that by the beginning of June, there might be at least a phase reopening in New Jersey. At least I think that I may have heard that. And some states are going to be opening up sooner, so we'll see what happens. All right. Okay, everybody have a good rest of the afternoon, and I'll see anybody who's going to be there on Sunday morning at 9 a.m. Okay. Take care, and I'll talk to you soon.